Hi, everyone, and thank you for joining us for our webcast today. Our topic is Heroes Work Here, the impact of COVID-19 on employee engagement. And as I know, COVID-19 has affected all of us. Um, there's been nowhere that it's affected anyone as much as it has the healthcare industry. And so I'm excited today that that's what we'll be discussing. And so uh, before we get started, just to give you a sense of some of the critical questions we'll be answering today. What's happening with employees right now in terms of their employee engagement and in terms of their anxiety? How do we develop strategies that help harness the good from this crisis? How can we sustain the learning and behavior practices that can make any organization stronger going forward? And how can we encourage employee recognition, engagement, and pride, especially during difficult times? Before we get started with the presentation, I just want to let you know that it's possible for you to earn credits. You can see there the instructions for how to get HRCI, SHRM, and CPE credits. It does require you to stay online for the entire webcast and to click OK for the 3 pop-ups that will occur. So please do that and let us know if you are one of those people who need some credit. Also would like to encourage you to go ahead and ask questions at any time in the question box. We will be taking questions throughout the webcast, and we can also have some time at the end for other additional questions. So with that, it's my pleasure to let you know that today you're going to be hearing from Zachary Lipner. He's the principal at HR Solutions. He also was the CHRO at Beth Israel Hospital for 15 years, and so we're thrilled to have him here to share his story. We also have Bob Nelson, who is a senior fellow here at the conference board and the president of Nelson Motivation. And we're excited to have you here as well, Bob. And with that, I will tell you just a little bit about uh, myself in a minute, but also wanted to let you know that Bob has very kindly offered to give a copy of his book to anyone who's attending this webcast. Feel free to email your name and your preferred physical mailing address to the email address on your screen. We'll also mention this at the end in case for some reason you can't write that down right now. But thank you, Bob, for making that available to everyone. The book is 1,001 Ways to Engage Employees. With that, I just wanted to mention a little bit about myself, and both Zach and Bob will be telling you more about themselves as well. But I've been at the conference board for 2 years and very excited to be here. I focus on uh, work in the employee engagement and experience space, as well as talent acquisition and job satisfaction. We're also working on some really interesting reports on social change. And I wanted to tell you about some research that we've been doing recently to find out about how organizations have been dealing with COVID. And so specifically at the end of August, we did a survey where we asked executives how they had been uh, getting ready to have their employees return to the workplace. And you can actually download that document. It's in your download files here box as well as this presentation. But we found in that survey that only 59% of the organizations that we surveyed had actually surveyed their employees to find out about their comfort level in returning to the office. So when we looked deeper into that, we found that the companies that had surveyed their employees actually responded very differently in terms of the safeguarding measures that they took. And so we were so interested by that fact that we said, well, you know what? Let's find out for those companies who haven't surveyed their employees, let's actually survey employees to find out about their readiness to return to the workplace. So with that, I'm actually really excited to share with you some information that hasn't even been published yet. Look, keep an eye out for next week. But you can see here that there's a big spread when we asked the employees, does your organization have a plan for how employees can return to the work site? So you can see that it's very split, but 5% say that returning will be required for all. 34% say that returning will be required for some, voluntary for others. You can see 17% say that it will be voluntary for all. but a really high number, 37%, say that it's not known at this time. So just think about the amount of anxiety that that can lead to, given that employees don't know whether or not they're going to be required to go back to the workplace. And you could also probably say that there's a high level of anxiety also for the group in the second group, those employees who returning will be required for some and voluntary for others. They might be anxious if that's actually not already decided. So in addition, we asked employees if they were comfortable returning to the workplace. And you can see here, 70% indicated that they were only moderately comfortable, if at all. Only 17% of the over 1,100 employees who were in our survey said that they were actually very comfortable returning to the work site. The rest are moderately comfortable, 39%, but pretty large number, 21%, said they weren't comfortable, and another 13% said that it depends. So again, there's a lot of anxiety. I think that their employees are concerned that they don't know, dates are changing. And so just wanted you to see that very recent data. And then we did, and I know this chart is incredibly hard to read, so download the deck if you can't read it and you're really interested in it. But we just wanted to show you, we asked the employees then, what was your greatest concern about returning to the workplace? And you can see there that the risk of contracting COVID-19 personally was the highest, followed by the risk of exposing family members to COVID-19. And very close to that is the lack of effective vaccine. So with that, I wanted to start us off with a polling question. First, I'm going to tell you about some of the work we've done. Sorry, I'm getting ahead of myself. We have been doing a lot of research here at the Conference Board recently on COVID-19. And so you can see there, all of these documents are available on the topic of employee engagement and experience. We've been doing a lot of work around employee well-being and mental health. We actually had a conference yesterday, the Employee Engagement and Experience Summit, that dealt with well-being, resilience, and employee well-being. We have a well-being conference coming up. I think there may be one in October and one in December. So if you're interested in that, feel free to look for them. You can obviously download any of these reports. And the one there at the bottom, Developing Resilience to Move Through Uncertainty to New Beginnings, it's actually in press. So that should be out very soon. With that, now we're going to go to our polling question. So I'll ask the digital media team to pull up the poll for you. We want to know, has employee engagement in your organization increased or decreased as a result of the pandemic? Because we've been hearing different things in the press. So you can tell us if it's increased significantly. Has it increased some? Is there no change? Has it decreased some, or has it decreased significantly? So we'll give you just a few seconds to do that, and to let us know, what your what you think is happening in your organization. And like I said, I'm expecting to see a wide range of responses, because I think at least I've been seeing in the press, in some cases, employee engagement has increased, but in other cases, I think it's decreasing. So if you would go ahead and broadcast the results, you can see that it is a pretty big mix. Although 33% said it has increased, another 40% said it has decreased some. So it's only 14% are saying that there's been no change, which I actually did this survey another time, and the no change was 0, and it was very close numbers to this in terms of the split between having employee engagement increase and having employee engagement decrease. So with that, let's find out how we think that we might be able to help our listeners, help your organizations learn how to take some good from this crisis and help improve employee engagement. And with that, Zach, I'll turn it over to you. Thank you.
Thank you, Robin. Welcome, everyone. When I do presentations, I usually like to start off with some humor, and not sure that there's much funny in COVID, but I would start with a COVID joke, but I really won't know for 14 days whether or not you get it. So we'll dispense with the COVID joke, but I will tell you also that my New Year's resolution last year was to stop hanging around with people who are negative. This year, I think, is going to have to be to stop hanging around with people who are positive. Now, I'll leave the humor aside and get to where I think the meat of what we're going to talk about today is. So a little statistics on Newark Baptist Israel Medical Center. I was the CHRO there for about 20 years, 32 years as an employee. Absolutely great organization. Always said I would never work anywhere else, and I lived up to that as I moved into semi-retirement and consulting business here. But Newark Baptist was a great place with some incredible employees who provided me personally with a whole bunch of inspiration during what was really about the most difficult time in my career. And I circle on the date March 15th. That is a date I will never forget. So just to back up a little bit from March 15th, about a year before, I had informed our president that I was planning to retire in February of 2020. Obviously, as HR, my job was to recruit a successor, and I had failed in that attempt at the time. So he asked me to stay until June the 1st, and I said, sure, no problem, be happy to. Figured I'd put my feet up on the desk, I'd take a victory lap, maybe even work 3 days a week, and cruise into retirement. I had no idea what I was getting into when I said yes to that in December of 19, and then on March 15th, I learned what my commitment really was going to turn out to be. I was administrator on call that week. It was a Sunday, and as is my custom, I would go in and I would round in the morning on the nursing unit to the organization to make sure everything was okay. And I came in to find our command center open, our senior clinicians there, and to find out that we now had 6 COVID patients in the hospital that had arrived within the last 24 hours. Clinicians and leaders were sitting around trying to figure out how we were going to care for these patients. Did we have enough PPE? After I sat there for a while and just took everything in, I got to spend some time with Dr. Matt Schreiber, who's our chief clinical officer, and he painted a horrific picture of what was to come. And by the way, he was absolutely right, spot on in terms of the picture that he presented. But I came home and I was totally depressed. I said, I didn't sign up for this. Why is this being brought on me when I wanted to just simply take my victory lap? But I went back to do my night rounds, as is my custom when I'm on call, and I spoke to our employees, and they were petrified. They had no idea what was to come, and neither did I. And we had lots of questions, and we didn't really have any answers. But in rounding that night and talking to the healthcare professionals working in our organization, I was personally invigorated. Whatever was to come, we were up for it. And as it turned out, we were, but it was quite a road that we went down. Over the next 2 weeks, exactly as Matt has predicted, the hospital emptied out. The nursing units were bare. Outpatient business gone away. We actually started flexing down staff. But then the census started to grow. The PPE issues started, and while we never ran out of PPE, we were always concerned about what our supply pipeline was going to be like, and that fear of PPE created a whole bunch of behaviors in the organization that we had to deal with as leaders. Staff pushback was acute also. People who didn't want to come to work, ADA requests, leave of absence requests. Let's face it, people were just scared. And I will tell you that as the workforce started to get sick, and within 6 weeks, 20% of our workforce had contracted COVID, we were really struggling with staffing. We centralized call-outs. We ramped up our employee health division. We actually had a nurse or nurse practitioner call every employee who had COVID symptoms every other day. And I can't tell you how our staff felt about that and how many comments I got when people came back to work and said, I look forward to that call. My doctor was hard to get a hold of. The news was horrifically presenting pictures of death and dying. And I was scared. But every 2 days, I got to talk to a nurse or a nurse practitioner about my symptoms and when I might be able to come back to work. So really, even in the fear and not having any answers, being willing to listen and validate people's concerns, I think, is an important thing in terms of improving employee engagement at this time. So we started to create manpower pools. We cohorted patients on nursing units. We effectively changed our model of care. It really was 1 minute at a time management. It was really intense. And on March 25th, I woke up with a 99.5 fever. Now, I will tell you that if this had not been COVID, if I had not suspected that I had COVID, and I did, if I had not suspected it, I would have taken 2 Tylenol and gone to work. And you can just think about how many people go to work when they're just not feeling 100% and are potentially making other people sick. So there's a lesson to be learned in there as well. But I then proceeded to have 7 days of low-grade fevers. Nothing that would have prevented me from working, and very frustrating not being able to help out the people on the front lines and all the things I was hearing about at the hospital and not being able to provide the on-site leadership that I think is so important. So I did emails, conference calls. I tried to direct the HR team, but it was really hard and frustrating because I could not deliver to the organization that I love. And as the workforce continued to get sick, staffing became an issue. More than 700 of our employees contracted COVID symptoms. For me, then after the 7 days, then I had the real sickness. I never had the respiratory symptoms that many had. I had some really bad gastric symptoms. I was a mess. But after 5 days of that horrible experience, I got better, and 3 days later, I returned to work. I'll tell you also that I got a pulse oximeter, and every time I stuck my finger in that pulse oximeter, I was nervous that I was going to get a bad reading, but I never did. So thank God I survived this thing. I did lose 15 pounds on COVID, but I wouldn't suggest it as a weight loss strategy. It's come back with more, as usually is the case after you lose weight. So I returned to work on April the 10th. By then we had 425 COVID positive patients in the hospital. Nurses were in spacesuits. Doctors, you couldn't recognize them. We had more details on every shift. We had a robust manpower pool with people from outpatient divisions and clerical staff working on inpatient units, supporting staff, being runners, being caregivers, doing all kinds of things. But as you rounded in the organization, and we rounded like crazy, as you rounded, people were just doing their jobs, sitting at computers, sitting at nursing stations, x-ray techs taking x-rays, respiratory therapists doing respiratory treatments, people delivering food. It was a weird normal in a sort of way, but again, no substitute for that rounding. That was key. The specter of disease was everywhere. During this period, 4 of our employees died, and dozens were hospitalized. But with all that going on around us, our staff was focused on 3 things: on mission, on safety, and on each other. Now, never in my 32 years of working at Northbeth did I feel an energy or a vibe like this. We'd worked through financial crises, mergers, good leapfrog scores, bad leapfrog scores, joint commission inspections, whatever it may be, but nothing drove employee engagement like COVID. People were just so focused on what they were doing. By May 1, the surge in New Jersey was over. We started closing units and our census dropped, and our conversation started to be about what do our finances look like? How do we get our safety program reinvigorated? What is the new normal going to look like? And then the ever-present worry, which exists to this day, of what might a second wave look like. On June 5th, I worked my last day as CHRO. I finally made it to the finish line, and I give my organization great credit. They sent me out in good fashion, as best anybody could. But I must say, it was a most fulfilling experience. I always considered myself a healthcare worker, but maybe that was a stretch. But I really felt like one now. Crisis brings folks closer together, and the experience of COVID capped my career with a sense of purpose and accomplishment. I, along with 3,700 employees, really felt like a hero. So, okay, so this chalk appeared one day outside the hospital early on that said heroes work here, and we rallied around that concept. And when I left on June 5th, that is exactly what it felt like in our organization. But the problem is that feeling of heroism doesn't last forever. Our accomplishments become forgotten, spotlight fades pretty soon, back to being just those people who work in the hospital. So my question that I wanted to answer was, how can we capitalize, and I don't really like that term, but how can we capitalize on COVID and this feeling of heroism and purpose before we return to the new normal, or as we make the new normal, so that we can improve employee engagement? So I think in order to have that conversation, I wanted to look back at the last few years, and 3 things two or three things that have happened in the last 3 years, last 10 years that have affected us. The conversations that we were having in leadership and across the organization with our employees, of course, focused on financial performance. We focused on HRO and safety activities. People are bombarded with, oh, healthcare costs too much, it's inefficient, we create too much harm, delivery model is changing, population health is coming. All of that to a staff member is confusing and doesn't really get to, I think, what turns them on. Stack on top of that the changing social nature of the workplace. The generational change is continuing to affect organizations. Loyalty to organizations aren't to what they used to be. I did 33 years in the same place. I don't know that anyone ever will do that again. We have 3-day work weeks in healthcare, and the consolidation of healthcare, the merging of hospital systems has made it so that those people who lived in the community, care for the members of the community, now probably feel like they're working for a big business, and that community attachment has dissipated. And as we all know, employee engagement has been relatively flat. I thought the poll was very interesting, Robin. Half the people said it got better, half the people said it got worse on average. It's exactly the same, right? Yeah, that was really, really telling.
Hey, really... I have a question for you before you go on to the next.
Sure.
I realize not everyone's going to know what HRO is when you say that there was a focus on financial performance in HRO.
Okay. Well, we could do a webinar about that. That would be great. Healthcare is trying to become a high reliability organization. Nuclear power, airlines, these are organizations that have significant risk, that have really minimized harm to the public in an incredible way, and they have a toolkit of solutions that we need to adopt in healthcare to make healthcare safer. Healthcare is not a safe place. People ask me, well, what should we do to fix healthcare in America? The answer is don't get sick. That's the best thing you could do. And I think with COVID, that remains the thing again. Stop hanging around with those positive people.
Hey, Zach, I'm so glad you explained that, because I thought it was HR optimization. And that's not it exactly. So
yeah, it's about safety. We don't really have time to go into it, but there's a lot of harm created in healthcare. Unfortunately, not because people aren't trying, but just because it is so complex and the delivery model is so difficult and changing that people make mistakes, because people are people. And when people on top of people are charged with providing care, mistakes are made, and that leads to harm. Just like in the airline, if there were mistakes, it would lead to harm. So how can we model that? And that's the HRO kind of philosophy. Thank you. We have to stay away from all of the acronyms in the world that exist. Okay, but let me see if I can get back to our little story here. So how do we engage with our healthcare heroes? How do we deal with this fundamental change in the workplace? The workplace will never be the same. It will forever be different. How can we engage and improve and make things better around COVID? Is there anything positive that we can get out of this? And I think there are 3 themes that we could look at that we can hop on. The first one is mission. The second one is teamwork. And the third one is this idea of high reliability and safety, which may be focused generally on healthcare, but I think that every industry is trying to be safer these days. There's an awakeness out in the world about safety in general and safety in the workplace. So let's see here. Okay. All right, so mission. Press Ganey, who does our employee engagement surveys, tells us that mission for not-for-profit organizations is the number one driver of employee engagement. The attachment to the mission is the number one driver of employee engagement. I think on the survey, parking is second, and attachment to mission is first. And for healthcare workers, this pandemic was game on. We're doing what we were trained to do to save lives. We weren't trained to do population health. They weren't trained to do high reliability. They weren't trained to increase market share. They weren't trained to save dollars. They were trained to deliver healthcare to individuals one at a time and to make their lives better and to ease their pain. And that's what healthcare workers were trained to do. So it resonates. And mission, which we've been hiding behind for years, and not really advanced in the light of all these other initiatives that sit out in healthcare is now back up on top. And if we can keep it there, that would be great. I mean, our community responded in incredible ways. Police drive-bys, fire drive-bys. The Blue Angels flew over one day. That was spectacular. We've heard from local leaders, from the mayor. Shaq and Magic Johnson sent us personal communications because they have some affiliation with our organization. Due to donations, for the first 8 weeks of COVID, no one in the hospital had to buy their lunch. Every day, lunch, dinner, 7 days a week were provided by the community around us, businesses around us. The food was just coming in, and anyone who's ever worked in a hospital knows that food is what makes the places run. And the pride was just unbelievable. In my 32 years of tenure there, I never saw pride like at that moment. It was astounding. So mission is back. That pride moment is back. That heroism feeling is great. How do we keep that idea of mission and saving lives and our call to purpose in front of our employees all the time? Because it's a better motivator than saving money. Here. Okay, teamwork. Overnight, our model for healthcare delivery changed. We had med-surg nurses become ICU nurses. We had pediatricians taking care of adults. We had surgeons performing medicines they hadn't done since they were residents 30 years before. We had cadres of staff from outpatient divisions doing all kinds of work. Everyone helped everyone else. And managers connected with their employees better than they had done in years. We've been begging them to connect with their employees, and they spent more time on the floor answering questions, supporting people. When we didn't have answers, that was okay, as long as we were there to support them. Every day, stories of heroism, creativity, resourcefulness were discussed in our daily huddles and communicated throughout the organization. And people look out for each other also. The number of peer-to-peer recognitions on our employee recognition website doubled. People looked at that recognition site. They hadn't looked at it for years, and it's an interesting social platform that we had, and really drove employee engagement also, and we rounded and rounded and rounded. Our president came in every night on the night shift to round on the employees on the night shift. And again, even though we didn't have answers, just showing that we were there for them was without a doubt a home run. We celebrated together when discharged employees when employees who were sick were discharged, and we mourned together on the 4 who passed away. But we came through it together. I think of the Rough Riders and Theodore Roosevelt. Those people who were with him on San Juan Hill, that defined their lives, and they were forever bonded together. My third theme around high reliability and safety is really what I think we need to continue to focus on in healthcare because of the harm that is created in healthcare. And I don't mean to scare anybody in terms of healthcare. We have a lot of great people out there doing great work all the time, but the complex work systems mean we need to do better in that business. One day I came upon a staff member who was putting on PPE, and this was not a person who normally would be working on an inpatient unit, so not a clinician. And before she went into patient room to deliver a tray, nurse stopped her and said, "Wait a second, let me make sure your PPE is on properly. Let me make sure you have that mask in the right place, that gown on properly, that you have everything in place." Watching out for each other. And as we talk about high reliability, and I think as we talk about workplace complexity in general, peer coaching and peer checking, the most important safety practice we have. Another interesting corollary from the COVID was the employee injuries went down. Back injuries went down, needle sticks went down, splashes went down, had a lot less injury. People were focused on what they were doing, and safety became a #1 priority. So as we return to the new normal, whatever that looks like, safety needs to stay on the top of our priority list. It never left, but we have a platform for doing it because everyone in the world is so focused on safety. So I believe that our COVID experience can carry us forward. I believe that there are lessons to be learned and positive things that we can do. But whatever we do, it will hinge on, or our success, I believe, will hinge on employee engagement. Maybe it's time to move that needle. maybe it's time to make our folks who are heroes feel like heroes every day, that we recognize them every day, that we understand their concerns, their fears, and deliver to them leadership that addresses all of those things so they can help to move our organization forward. And that's my stick for today, and I'm happy to take any questions.
All right. Well, we've got a number of questions, and Zach, thanks so much for sharing that. For those of us who aren't as close to this as you were, and the people in the hospital, all of the staff were, obviously we don't know what this all looked like. So I have a question for you, which is, how did you manage? You were talking about the staffing issues when you had so many of your staff out with COVID. How did you manage from an HR perspective moving people around? So you were mentioning this person who wasn't a clinician, was delivering a tray. How did you manage that whole puzzle? Because I'm sure it was moving, changing every day.
It was, and people were really reluctant to do it. Trying to even get managers to say, I don't need this person to be in my outpatient department, take them into the inpatient department, was really, really hard. And some might say, well, I'd rather not work than do that. And we had to walk a very fine line between threatening employees' jobs, which we didn't want to do and did not do, but making them understand the importance of them coming to work and take care of patients. The firefighter doesn't get to say, oh, the alarm went off, I'm not going to that fire unless you do something for me. Or I'd really rather not go, call somebody else. We're healthcare workers, and we kept making that point. And I think that as we showed that as leaders, we were just as clueless as everybody else, but we were in it with them. People wanted to do that. And a little bit it was getting people back. And then once they got back, and they got onto these nursing units and felt the culture that was going on there and the teamwork and the staff caring that was going on, they were quite happy to be there and quite enriched.
All right, here's another question for you. You mentioned rounding on the employees. I think many of us are familiar with the idea of rounding on patients, which is something that doctors do. And if you've ever been in the hospital, you can expect to have, a doctor come and see you, your doctor come and see you. And then if you're at a teaching hospital, you can expect a whole posse of people to come in and see you. But what do you mean by rounding on employees? You also mentioned that your president was coming in every night. So I'd love to have you chat a little bit more about that.
So if you're a patient, you get rounded on, which means that clinicians stop in, check up on you, speak to you about how you're feeling, give you some feedback about your care. We round on employees with the exact same approach. How are you doing? Is there anything I can do to help? How are things today? Are you feeling better? If you're not feeling better, what can I do to make you feel better? But one of the hallmarks of Newark Beth Israel Medical Center, one of the things I've loved for our years was we may have had 3,700 employees, but it always felt like a small place, or at least it felt like a small place to me, because of the level of concern that we have. And our president, who started as an operations manager back in the days when I was a food service director, we grew up together in this business. We loved our employees, and we wanted to show that. We didn't have answers. And an easy answer would have been, well, go hide in your office if you don't have an answer. A harder thing to do is to say, you know what, I don't have an answer, but as soon as I get one, we'll get it to you. But in the meantime, we just need to figure this out 1 minute at a time. And I think our employees really appreciated that.
Well, and I also expect that having your president show up every night sent a message that, I don't know if it was a he or a she, but that they understood what was going on and that the sacrifices people were making.
Yep, he's an incredible guy. Great leader.
A comment came in here that says higher engagement led to better safety marks. Great example. In the academic research, it does show that higher employee engagement does lead to better safety, but that's an awesome example that you shared with us. Any suggestions for organizations who are trying to increase their safety and their engagement thereby?
Well, even if we go back to the idea that I said that if I had not known that I had COVID, I would have come to work, right? So presenteeism in and of its own self is a problem, but we can cut down on workplace transmission of everything from cold to influenza to COVID by continuing to wash our hands, to clean our workplaces, to wear our masks, and to care for each other. Because I think that teamwork pillar that I sort of talked about spills over into the safety world. When we as leaders show that we care for the well-being of our employees, we have nurses just calling employees and saying, "How you doing today? I understand you were sick today. Your symptoms any better? Maybe you ought to call your doctor. We've heard this is working for others." They didn't have any idea either how to treat this disease. Just keeping those communication lines open and that caring, because if we care for ourselves and we care for our coworkers and we care for the people who are our subordinates, we will be safer.
No, that's exactly in line with what we've been finding out about the transparency. The more transparent leaders are, their communications are more genuine, the more employees feel cared about.
We don't have all the answers. We don't have all the answers. It's okay.
It is okay. Bob, do you have any questions for Zach?
No, I'm just glad he's still with us. It's got to be a scary thing.
No, and so having 700 of your workforce out, I don't know if anybody remembers, but that's a high percentage of your organization. And I can only imagine how complicated that was in terms of staffing and the increasing in cases. So thank you.
I do have one question. Did you find, did your hiring practices throughout all that change? Did you find that you're more desperate for certain positions?
I was actually surprised to see that people were still applying for jobs, and that people were accepting offers to work at our organization during COVID, and people who volunteered, community members who said, "I have a job, but I'm laid off. Is there any way I can help?" I found all that to be incredibly inspiring. But I wonder whether healthcare workers today, or the next generation of healthcare workers, is now going to weigh a little bit more on the risk side. The rewards have improved over the years. Nurses are still underpaid. Healthcare workers are still underpaid. The dollars are still shrinking when they need to be expanding. But if you're attached to that mission, you will be a great healthcare worker. And if you're trying to get into this business because, you hear you can work as a nurse 3 days a week and make 100 and change, those people may weigh the risk a little bit more.
Another question came in. Do you have any recommendations for supporting employees that are feeling burnt out? I know that happens a lot in healthcare.
I'm going to leave that to the psychologists. There's a whole emerging science around burnout and stress that came from this. I came across someone who's got an app where people can talk to non-professional folks. I think you have to talk it out, but I will leave the stress management side of it to the psychologists right now, because I'm not sure in HR I ever found the answer to burnout.
I would actually say that one of the answers to burnout might be around resilience and the importance of developing that. And we're about to publish a report on that later this month. So stay tuned and hope you guys will look for that. Bob, did you have another question, or should we go on to the next poll? All right, let's go to the next poll.
Let's go.
So we want to ask you all a question around, what do you think is the most important thing? How can increased employee engagement be sustained? Increasing employee recognition and rewards, asking leaders to be more hands-on with staff, embracing transparent communication, increased learning and coaching opportunities, more actively involve staff with decision-making. So while we will, I don't think that there's a wrong answer here, but it would definitely be very interesting to see where your heads are at today, and we're going to then give you some ideas for how you can actually sustain employee engagement. So give you guys just a few more seconds before we ask the team to close it down. All right, so we'll go ahead and broadcast the results. And as I expected, there's a pretty good that comes 7%.
You're breaking.
That can go together. We heard that example from Zach. about having their president show up. And so I think that there's a lot of things we can do. And I'm actually going to turn it over to Bob, who's going to talk to us about employee recognition and rewards and how important those are to employee engagement.
Thank you, Robin. And on these results, it's interesting because I did a research on looking at 52 explicit behaviors in the workplace a couple of years ago, and the #1 ranked item that employees said was most important to them was communication, honest, sincere, two-way communication. So that's it's a baseline, it's a foundation for any strong relationship and culture. I am going to, we need to, can we remove the poll? Thank you so much. Yeah, here's some information about me. I've spent 25 years looking at the topic of employee recognition and engagement, and done a number of books about it, and do consulting. Love the topic. When I started, I thought I'd do this for a while, but some of the answers that seem so easy are not necessarily easy to implement, and so it's been a ongoing struggle or opportunity to try to connect the dots and help organizations elevate their focus, and that's what we are going to talk about here. That and one of the answers that from research that I've gotten looked at is that in times of stress, in times of change, which we're all in high-tech times, and we're all spending all our time on screens these days, the importance of recognition reward is for high performance is even more important. And this is the theme that I wanted to develop in the brief time that we have. I actually did my doctoral dissertation on why managers do or don't use recognition. We already know it's the #1, the greatest management secret in the world. It's called is that you get what you reward, and recognition I define as acknowledging and appreciating people for their achievements. Notice it doesn't say for showing up to work. And you would think that would be the case because of how a lot of organizations do it, that we do stuff because you're here. Here's a party. Here's donuts on Friday. Here's a service award. The key here is to have the focus be on achievements, on ideally things that stem to strategic objectives, to core values, to things that will make a difference in our mutual success. The recent research by the Harvard Business Review reinforced this, that recognition given for high performance they found is the most impactful driver of employee engagement. Not to discount what you're saying, Zach, about mission. That's on the list too. And I think these variables shift around some. I also, in recent research, I've seen that career development ranks right up there as being critical for having people know where the future is in the organization, and are they learning the skills. And so to me, for any leader, part of getting to know people is to find out where they're trying to get to in their career and their life. And my simple definition of engagement is to align personal aspirations with strategic objectives of the organization. And the person to do that, has the best access to doing that, is the individual leader. And to help them, encourage them to have that conversation, to do one-on-ones, to do skip-level meetings, to allow people to see their future in the organization, it goes a long way in having them want to stick around and use their discretionary energy to do their best. In my doctoral research, one of the things I looked at was how often people felt that they got recognition that mattered to them, and it was almost universal. 99.4% said that they expect to be recognized when they do good work. And the one word that's different on this than maybe 10, 15 years ago is the word expect wouldn't have been in the variable. People, if you asked them 10 years ago, hey, what would you like from your manager? Is recognition important? They typically would say, well, it'd be nice if my boss did something every now and then. Today, it's no longer optional. Employees have an expectation that if they finish a project, if they suggest a money-saving idea, if they do a core value, help a team member without being asked, that people notice, that someone notices, especially their boss. And this is especially true for the younger generation, the millennials that currently make up the largest majority of the workforce. They actually expect to be recognized, if you can believe it, on a daily basis, which drives the baby boomers absolutely nuts because, they've got a job to do. I can't be spending my time, telling you you're doing a good job, but you do need to integrate that into your behaviors, into your interactions to get the word out. Gallup has found that ideally in their core Q12 that it's one of the core variables for driving performance and distinguishing high engagement cultures from none. And to them, their baseline is getting every employee being recognized at least on a weekly basis. And for all your employees to feel it weekly, the leader typically has to be doing it daily to get around to everybody. So it's not everybody every day, but every day something. And so it's part of your behavioral repertoire, I like to call it, that you're constantly having in the back of your mind looking out for who's doing a good job and what does it look like, and then saying something, doing something in response to that. Right now, only 12% of employees say that they feel recognized where they work, 12%, in ways that are meaningful to them. And this is really where it starts, is taking time to find out what's important to people. I don't think I've ever worked with an organization where and when I ask them this question, what do your people really want, what motivates them, they all feel they know the answer. And yet they never have taken the time to specifically ask. And so they say, well, of course it's money and it's benefits and promotions. And was that what they said? Well, no, we just know that's the case. Well, take time to ask them, because you might be surprised. Someone might say flexibility. They might say, again, learning opportunities. It's all over the map. And in fact, it varies a little for each of us, and it varies over where we are in our career. So the motivation is a moving target. You've got to be on the spot with what's important to your people and visit that often. So only 12% of people feel recognized today. 3 times as many, about 34%, say they're not recognized in ways that are meaningful to them. The things that are done in their organization don't speak to them. They don't motivate them. I'm going to say a little bit more about that in a minute. And yet 80% of managers feel they're pretty good at this topic. And this difference between 12% that are getting it and 80% of leaders saying that they're doing it, I call the knowing-doing gap. And most managers know that this is important to do, but they actually aren't doing it in their behaviors to the point that employees are seeing it, they're feeling it. And this is what we most need to address today in organizations. As we move faster, as we become more technology-based, as often we have our managing people that are at a distance, we have to be better at the touch points, at connecting with people to make them feel valued when they've done things that deserve that. This is true in any given relationship, and if you do enough of it in your organization, you get enough leaders involved, it can become a cultural aspect and have a value of recognition. And when this happens, there's some magic that takes place. So in research I've seen that in the hospital environment, as few as 10% of leaders, if they engage in recognition activities, can move the needle and convert the whole organization where it becomes a common practice. Certainly by the point where you get 60 or 70% of leaders doing it, it becomes part of how we do things around here, and an ongoing part that we always take time to thank people, to recognize people, to celebrate milestones, for example, and to the point where it becomes an expectation on the part of employees where they can count on it. If you get to this point, which I think is doable for every organization, your employees will feel 5 times more likely to feel valued than an organization that does not have that culture, such as the organization that Zach worked in, where they had the tools and they had the focus on recognition on an ongoing basis. They'd be 6 times more likely to strongly endorse the company, the organization, as a great place to work, which is a key engagement metric. They will be 7 times more likely to stay with the company for their careers if possible, which this is kind of the price of admission right here. If doing this activity will lead to people, the talent, the high-skilled people that you need to keep to stick around, there's no other reason you should do it than this right here, because this is going to make your life easier. It's going to bring down your costs. It's going to increase your the tenure of employees that are actively engaged in their time with you, and 11 times more likely to feel completely committed to their jobs, to their manager, and to the mission of the organization. So this is a lot of impact on a very simple, almost common sense behavior of thanking people when they do a good job. Voltaire that said in the 17th century that common sense isn't often common practice, and nowhere is this more true today than on this topic. And so if you want to keep engagement alive, if you want to take it up a notch, wherever you are, starting where you are, you can do these things that systematically make it a part of a cultural variable in your organization. And this is the difference between, in any relationship that recognition works, whether with an employee, with your boss, a coworker, even at home, with your spouse, with your kids, we know that this works. But as an organizational element, to get the power out of it, the Aberdeen Group found that the #1 best-in-class strategy for improving employee engagement was a strategic, integrated employee recognition and reward program. So a system, if you will, going where it's happening. So if historically in the healthcare industry, and I've worked with over 100 hospitals, we find that often what's happened is, in the turn of the century, the nuns started the hospital, and over time, as things grew, we did certain celebrations. We did years of service, which again is as a good variable, how long someone's been with us, holiday parties, summer picnics, birthday celebrations, Employee of the Month, Daisy Awards is another one, retirement parties. This kind of is what recognition, in my experience in hospitals, tends to be. And when I look at this, it's more the focus on the presence over the performance. If you're just recognizing presence, you end up with a culture of entitlement, where people expect to get more and do more just for being there, just for showing up today. Now, where's the donuts? If you move that towards reinforcing performance, not only do you get more performance, but people feel more valued in the role they have in driving that performance. So you take something like years of service, which 92% of organizations do. I've never met a person that stayed a day longer in their job to get their 10-year pin. Or you look at Employee of the Month, which sounds like it's performance-based. That's a good one, right? And on the surface, it looks like it, but and the first person you recognize, you got the right person, way to go. But what tends to happen, and it may be 2 days, it may be 2 years, you get to a point where there's a group sitting around a conference table, and someone says, hey, it's time to pick Employee of the Month. Well, we just did that. Yeah, 30 days ago, it's another month. Well, what about Betty at the front desk? Don't you remember she got it in February? Oh, I forgot. You can only be excellent once in this organization. You're putting a quota on performance. So Betty's off the table. Now we still have to find someone, and come on, we're in a hurry. We got a lot on the agenda. So what about Fred in shipping? Well, does he deserve it? Who cares? We're going to be here all day. So you give it to Fred, and his reaction is, I knew if I hung around here long enough, someone would notice me. And the whole thing becomes a joke. You're taking the most powerful principle we know about driving performance and motivation, and you're turning it into a joke by just going through the motions. This is what I see in healthcare. This is what I see in all organizations. And I'm imploring, I'm on a mission to say, stop it. Retool, restart over, and stop doing the things you've always done since the 1940s that I'm not even sure if they worked then, but they definitely are not working now. It doesn't make sense to do a years of service at 5, 10, 15 years when the average millennial is going to leave on average after 18 months. It's a disconnect. We've got to retool and engage your population where they are now as to what they want, and give them those things in a systematic way as they show they deserve it by the performance and the behaviors they present. And so let me just say what this looks like. It's moving from presence, a focus on presence, to a focus on performance. Okay? Ideally, from the largest performance strategic objectives, core values, KRAs, okay? But not just for showing up. If you're here at Thanksgiving, where you give you a turkey. If you're here at the end of the year, you get the employee party. That is out of touch, out of time. It's bringing it real, here and now. From doing random and disjointed things to a consistent and consolidated things, having an umbrella of which all your activities on this topic link to the same point, the same direction that align with the objectives of the organization. Typically, without doing that, you have different departments doing different things. I've worked with organizations that have as many as 200 different things going on. Some people are bringing in Starbucks cards, and if it's random, you get random results. It becomes more of an administrative burden. You've got to move from that to use the power of technology today, which is incredible on this topic, to have platforms where you can allow for a peer-to-peer recognition, where you can recognize anyone in the organization, where you can publicly recognize them. It's unbelievable. If you haven't seen those, they're excellent and they're very affordable. You've got to take a look, because it might be the ticket for you. To go from not measuring, and here's the thing: if you do Starbucks cards and you pass those out at the end of the year, you go, well, we spent a lot of money on Starbucks cards or gift cards or whatever. What do we get back for it? Who knows? Well, who got them? Don't know.
Bob, I'm so sorry to interrupt, but you're so passionate about this topic, but we need to actually finish up this webcast, so that we end on time. I'm so sorry.
Let me wrap that. So from that, to something that's more systematic training, from one size fits all to having all the diversity of choice that's available to you. I'm done.
All right. Sorry. I did want to let you all know, if you didn't catch it at the beginning, that Bob has very kindly offered a copy of his book to everyone, 1001 Ways to Engage Employees, if you would send him your name and preferred physical mailing address to the email that's there. We don't have time for a lot of questions, unfortunately, but there's been a lot of comments that have come in, and we'll make sure that you get a copy of those, Bob, just so that you can see people are agreeing. There's some examples of people. One person said that when they open their monthly team meetings, they open with success stories, and everybody seems to like it. Someone else mentioned that their employees prefer team rewards rather than individual rewards. And so, you know, I think what you said about everybody preferring something different, all employees preferring something different, that's very true. So before we give you guys the feedback form for today's webcast, we'd just like to remind you that we have the COVID-19 pandemic resources and support for the human capital community. We have a hub that we put together right after COVID started, and we've been updating it. You can see there's a link there at the bottom, but there's articles on all of these topics there, as well as all of the research that we've been doing on these different topics. Wanted to let you know that we've got some upcoming webcasts. Specifically, you can see Reimagining Compensation, the Human Capital Watch coming up on October 21st, Coaching the Future Digital Worker, and then a webcast that I'm actually involved in, From Immediate Responses to Planning for the Reimagined Workplace. That is actually all based on our most recent COVID survey, when we had over, I believe, over 300 HR leaders who answered that. So that should be a really interesting webcast. Also wanted to let you know we have a podcast series, and we try to cover our new research, but also books by new books that have just come out with conversations with the author. And with that, I'm going to thank you all for joining us today. We really appreciate you. Thank you, Zach, and thank you, Bob. And now we will ask you to please fill out your evaluation so that we can continue to make these webcasts as good as we can. Thank you. Have a great day, everyone.